You're viewing this section on the phakic intraocular lens either because you're too nearsighted to have LASIK or an advanced surface procedure, or the configuration of your cornea is such that it's not safe to perform LASIK on the surface of your cornea. Please review or re-review the section on LASIK, as many of the expectations, the limitations, as well as the side effects and risks and complications are the same for LASIK as they are for the phakic intraocular lens. Now, the phakic intraocular lens, also known as the phakic implant or the implantable contact lens, is a small lens which is permanently placed inside the eye. The lens either goes in front of the iris, which is the colored portion of the eye, or behind the iris in front of your own natural lens. And these lenses are permanently placed inside the eye. The procedure consists of making a small incision right where the white part of the eye meets the colored part of the eye. The lens is then slipped into the eye and positioned in a permanent fashion. The procedure is performed under local anesthesia at our federally certified and state-licensed ambulatory surgery center. It takes about 15 minutes to do the procedure. You're at the center for about 2 hours where we prepare the eye for surgery and examine you after the surgery. Then you go and have some lunch and come back, and I examine the eye about 2 hours after the procedure to make sure the pressure in the eye is normal and that the lens position is excellent. You then go home and rest and relax, and I see you the next day. At that point, I examine the eye, and you can go to work the next day. Now, we only do one eye at a time, and I typically do the second eye about 3 days after the first eye. In the meantime, you can wear your contact lens in the eye that we don't do, so you can function and drive and work. Now, your realistic expectations for these procedures are quite similar to LASIK. The results are excellent, but they're not perfect. Accordingly, you must plan to have a touch-up procedure a few months after your initial procedure. Now, the touch-up procedure for the ICL consists of either a LASIK or an advanced surface procedure performed on the cornea. This is especially true if you have underlying pre-existing astigmatism. Now, in the FDA studies, only about 50% of the people needed a touch-up procedure following the lens implant. In my personal experience, only about 10% of people require a touch-up with LASIK or an advanced surface procedure after the surgery. But I don't know who will and who won't. So I recommend that everybody that goes into the surgery must plan on needing a touch-up a few months following the surgery to fine-tune the vision. Now, if you're having the surgery because your cornea is underlyingly abnormal, such that it's not safe to do LASIK or an advanced surface procedure, then after the implantation, even if your vision isn't perfect, it still won't be safe to perform a surface procedure or LASIK. So after the procedure, if your cornea is underlyingly abnormal and your vision isn't perfect following the implantation of the lens, then you would need to use glasses or contact lenses to fine-tune your vision. Your vision will still be enormously better, but if it's not perfect, glasses or contacts would be the only safe way to improve the vision. Now, at least 2 weeks before the implant procedure, I have to place 2 very small holes in the colored part of your eye, or the iris. That is done in our office painlessly with what's called a YAG laser. Now, these are performed so as to equalize the pressure between the back and the front chambers of the eye. Because once the implant is placed in the eye, it can occlude the pupil, which is that hole in the center of the iris. If that pupil is occluded and you don't have alternate routes of internal fluid circulation, then the pressure in the eye can go up high, and that could damage the eye, and we don't want that. So at least 2 weeks prior to your implant procedure, you come to the office. You can drive to the office and drive back. You don't need a driver. I painlessly place 2 small holes in the iris, and then we put you on drops after the these are called iridectomies, after the iridectomies, and then we perform the surgery 2 to 3 to 4 weeks following these iridectomies. Let's take a few minutes and explore the potential side effects as well as the risks and complications of the phakic intraocular lens. Now I want you to go back, as I said, and re-review the LASIK section, because many of the realistic expectations, the limitations, and the risks and complications are the same for LASIK as they are for the ICL. For example, the possibility of overcorrection or undercorrection or the induction of astigmatism where no astigmatism existed before are essentially the same for LASIK as they are for the ICL. Additionally, the possibility of glare, halos, starburst around lights, or decreased contrast appreciation can also occur following the implantation of these lenses. And the potential need for glasses afterwards, particularly for night driving, or if you're over 45, certainly required for reading if we don't do monovision. All those are essentially the same for the phakic implant as they are for the LASIK procedure. Now, what about the actual risks and complications? The good news is they're quite rare. Like LASIK, they can be categorized as mild or severe. Now, they're slightly different than LASIK in that LASIK is still a relatively surface procedure. Even though we make a flap, it's still on the cornea, whereas the phakic intraocular lens is actually an intraocular procedure. That is, it's a little more invasive in that we have to go inside the eye, and that has its own set of unique risks. Now, the mild complications consist of, for example, chronic low-grade inflammation inside the eye or chronic low-grade increase in pressure inside the eye. Now, these can usually be treated with drops, but occasionally will require the removal of the lens and possibly even the continuation of drops for many years to control these situations. Fortunately, these are very rare, and actually in the FDA trials, as well as in my own experience, we haven't experienced any of that at all. Now, seen in the FDA trials, but not in my series, is the need to remove and replace the implant, or to remove the implant completely because it just isn't working for the patient. And fortunately, they can be removed, although of course it requires a separate surgical procedure. Now, the serious complications, again, are very rare. If they were very common, then the FDA would never have approved these lenses. They consist of the possibility of infection occurring inside the eye. Now, if that happens, and it's quite mild, it can be treated with drops and possibly the removal of the implant. But if it's very severe, it can result in total blindness in the eye or loss of the eye completely. This was not seen in any of the FDA studies and has never occurred in any of my patients. Now, the pressure inside the eye can go up suddenly as a result of these implants, and that's why we place those two small holes, or the iridectomies, inside the eye. I always check before I do an implant to make sure that those iridectomies are open. If they're open, and that's also why I place two iridectomies for extra safety, then the pressure can't go up in the eye. So again, in my experience, it hasn't happened, and in the FDA experience, it didn't happen when the iridectomies were open. Now, bleeding can also occur either at the time of the surgery or in the early postoperative period, such that the blood needs to be rinsed out of the eye and the lens may need to be removed from the eye. Again, I have not experienced any of that in any of my patients. There can be problems with the optic nerve or the blood vessels in the back of the eye. There can be problems with bleeding underneath the retina in the very highly myopic patient, the very, very nearsighted patient. And also in the very nearsighted patient, there can be problems associated with retinal detachment. Now, you have to understand, patients undergoing the phakic intraocular lens, by definition, are generally very, very nearsighted and are at risk for retinal detachment and bleeding underneath the retina anyway. So it's not clear whether in the FDA studies, and these occurred about 1% of the time in the FDA studies, whether they would have occurred anyway as a result of the very, very high degree of nearsightedness of this patient population. In my experience, I haven't had any patients with either of these conditions. Now, in the FDA studies, so far not in any of my patients, but in the FDA study, about 1.5% of the patients developed a little cataract inside the eye. Now, a cataract is a clouding of the natural lens that's inside your eye. It's behind the iris. You can't see it. If the lens becomes so cloudy that it obscures the vision, then the lens needs to be removed, the cataract then needs to be removed, and then a new lens is placed in the eye. Now, fortunately, the results are excellent after this procedure. It's just like a cataract procedure that we generally perform on elderly patients. The only downside to that is, of course, it requires a second surgery, and also the cataract surgery itself has potential complications such as bleeding, infection, or retinal detachment. The good news is that in my experience, I have had no patients develop a cataract requiring removal of the cataract. And in the FDA trials, they were very rare. About 1.5% developed a cataract, and about half of those actually required removal of the cataract. I understand that these complications seem frightening. But again, like LASIK, we have to keep them in perspective. They're very rare, and when complications occur, they tend to be quite mild. ICLs are safe and effective. I have implanted more than 10,000 of a similar lens in association with cataract surgery, and my complication rate is exceedingly low. My infection rate is about 1 in 4,000 eyes, and in those few eyes that have developed infections following cataract surgery, the infections have been mild, easily treated with drops, and haven't resulted in the loss of an eye or anything serious like that. We implant these lenses with my very experienced surgical implant team in my own federally certified and state licensed ambulatory surgery center. Serious complications can occur, and they do occur, but I'm happy to say they generally are mild, and in my experience with phakic intraocular lens surgery, I've had no significant complications, either infections, retinal detachments, or certainly any serious complications resulting in loss of vision or loss of the eye.